we are going to see eosinophilic esophagitis. What is the definition of eosinophilic esophagitis? Symptoms related to esophageal dysfunction, symptomatic, and eosinophil-predominant inflammation. As we already saw, more than 15 eosinophils per high power field. Okay, mucosal eosinophilia is isolated to the esophagus and persists even after PPI trial. So usually, any biopsy which we get in context of dysphagia or dyspepsia, the patient must have undergone a PPI trial already. So usually these patients undergo a PPI trial. So even irrespective of the PPI trial, if the mucosal eosinophilia still persists, then that is one of the diagnostic criteria. Secondary causes of esophageal eosinophilia are excluded. For example, fungal infection or any other causes of eosinophilia are excluded. A response to treatment, dietary elimination, topical corticosteroids supports the diagnosis but not required for the diagnosis of eosinophilic esophagitis. So this is an endoscopic finding of eosinophilic esophagitis. You can see that there is something called as feline esophageal appearance. Feline esophageal appearance is nothing but you can see longitudinal ring-like structures. These ring-like structures are not very common in human esophagus. So, and you can see these white structures. These white structures are eosinophilic microabscesses. These are also a clue in endoscopy. So these white punctate spots in endoscopy correspond to eosinophilic microabscesses. Okay. There is no exact criteria to categorize, but still most widely accepted criteria is more than 15 eosinophils per high power field. That is in any high power field. You can scan through the slide, and in any high power field, if you have found more than 15 eosinophils, then that should be counted. And eosinophilic microabscesses can also be an additional pointing factor. There might be many granulated eosinophils. Okay, usually while counting these 15 eosinophils, granulated eosinophils should be avoided because only granules should not be counted as eosinophil. Rather, intact eosinophil should be counted while counting. What are other histologic findings? As I said, it can cause great overlap with reflux disease. For example, there is reactive basal hypoplasia, subepithelial fibrosis, and superficial layering of eosinophils. So, eosinophils can be present in all layers of the epithelium. What are other conditions which come in the differential diagnosis of esophageal eosinophilia? GERD, this one we already discussed. PPI responsive eosinophilia, some conditions, eosinophilia, mucosal eosinophilia may be present, but after giving a PPI trial, the eosinophilia will vanish. So that is PPI responsive esophageal eosinophilia. And then we have eosinophilic gastrointestinal diseases, Crohn's disease, infectious conditions, hypereosinophilic syndrome, eclampsia. So there are a variety of conditions which can cause eosinophilia. Eosinophilia may be patchy, and it is recommended that 2 to 4 biopsies from at least 2 locations of the esophagus should be taken to maximize the diagnostic yield. Because as we saw, even in this endoscopic image, we saw that the eosinophilic microabscesses, there are a few normal areas here and there are a few whitish areas here. So it is not a very continuous disease, it is a patchy disease. So multiple biopsies are required for a proper diagnosis in the correct clinical context. The distribution of eosinophilia is important as they may be identified in both proximal and distal biopsies or be more prominent in proximal biopsies. Practically, only intact eosinophils with visible nuclei should be counted and eosinophil granules should not be included. So, degranulated eosinophils should not be counted by counting in high power field for eosinophilic esophagitis. So, this is just a sample report. So, the esophageal biopsy, usually it is ideal to get 2 to 4 biopsies, but this is in the context that we got 2 biopsies from distal esophagus and mid esophagus. So, in that case, we have to separately mention that this is a distal esophageal biopsy, what are the findings of the distal esophageal biopsy we have, and mid esophageal biopsy, what are the findings we got. So, usually these are the findings: basal cell hypoplasia, abundant intraepithelial eosinophils, edema, papillary elongation. So definitely we have to, when any biopsy, we have to mention that there is negative columnar epithelium and negative dysplasia. So the same thing. And approximately how many eosinophils were seen in what power and what is the final impression. So this is a sample report of eosinophilic esophagitis.